নতুন আরেকটি ভিডিওতে আপনাদের সবাইকে স্বাগত জানাচ্ছি বন্ধুরা। আশা করি যে যেখানে আছেন সুস্থ আছেন। আজ আমাদের সঙ্গে ইতালির একজন চিকিৎসক যুক্ত হচ্ছেন। ওনার নাম হচ্ছে মারিনা তাজোলিনি। প্রফেসর ডক্টর মারিনা তাজোলিনি হচ্ছেন ইউনিভার্সিটি অফ বোলোনিয়ার ডিপার্টমেন্ট অফ মেডিকেল অ্যান্ড সার্জিক্যাল সায়েন্সের চিকিৎসক। তো এই ভিডিওটা আসলে মূলত এই প্রফেসরের সঙ্গে মানে যুক্ত হওয়ার সুযোগটা তৈরি হয়েছে হচ্ছে ভয়েস অফ হিউম্যানিটি যে অর্গানাইজেশন আছে কক্সবাজার ভিত্তিক বাংলাদেশ সরকারের রেজিস্ট্রেশনকৃত সেই অর্গানাইজেশন আজকের এই ভিডিওটা আসলে মূলত আয়োজন করেছে, এই ইন্টারভিউটার মূলত আয়োজন করেছে। আমাদের সঙ্গে আরো যুক্ত হবেন প্রফেসর লুইজা, তিনি একজন সাইকোলজিস্ট। আর আমাদের সঙ্গে বাংলাদেশের কিছু তরুণ চিকিৎসক আছেন, আর ভয়েস অফ হিউম্যানিটির প্রধান উদ্যোক্তা মিস্টার হাসান আমাদের সঙ্গে যুক্ত হবেন। তো আজকের এই ভিডিওতে মূলত বাংলাদেশে যে করোনা ভাইরাসের প্রাদুর্ভাব চলছে সেই বিষয় নিয়ে সার্বিক আলোচনা হবে এবং করোনা ভাইরাস প্রতিরোধে কি ধরনের চিকিৎসা নিতে হবে, কি ধরনের মেজার নিতে হবে, সেই বিষয়গুলো মূলত আজকের এই ভিডিওতে আলোচনা করবেন ডক্টর মারিনা। তো শেষ পর্যন্ত ভিডিওটা দেখতে আমাদের সঙ্গেই থাকুন।
Hello, dear professor, and welcome to Voice of Humanity Foundation, Bangladesh. And I am inviting you to present your discussion of this video conference, please.
Okay, thank you very much. I appreciate your invitation. My name is Marina Tadolini. I work at the University of Bologna as infectious disease specialist. And I'm also WHO consultant in the last 10 years. I've been working as a WHO consultant and I was WHO staff. So I was asked to tell you our experience, what we are facing in Italy about coronavirus epidemic. So I'm going to describe the situation here. I do hope nothing similar will happen to Bangladesh. I hope you can manage the situation and then you have a different epidemic. So the health system is extremely under pressure because we had to create space to accommodate all of them, requiring hospitalization. And that means that the entire health system is now focused to provide care to patients affected by coronavirus. It's an emergency. Clinical situation may change very dramatically in few hours, so it's very important to be prepared and to start the preparation well in advance before the epidemic arrives, because after that it's too late. So preparation should not only mean train doctors and nurses to identify people with symptoms and provide management, but also prepare hospital facilities, infrastructure, create space in case huge number of patients will be affected. The infection spreads very rapidly. The infection spreads through, it's not airborne, it's through droplets and through contact. So droplets and contact. You may find a lot of guidance documents in the, for example, WHO website. There is a very nice collection of documents. I may share with you a lot of guidelines on how to prevent infection spreading, how to use personal protective equipment, how to make a rational use of them. We are also facing a shortage of PPE. So it's very important to prepare in advance, procuring PPE and using them in a rational way. So there is a lot of steps that you may already undertake. So to be not ready, because nobody could really be ready, but at least to prepare as much as you can to face and to tackle this emergency. So PPE use, procurement, rationalization is extremely important. To protect yourself and Another problem is that a lot of healthcare workers are exposed to the infection because, of course, you don't know if the patient you are handling is affected or not. So you have a very high risk of getting infected as well. So you need to prepare and to study and to read documents on the best way to prevent infection and to protect yourself. There are different levels of protection and different levels of PPE that you may use depending on the activities that you perform with your patients. What I can recommend is to read the documentation that has been produced by WHO. It's very clear and provide a good guidance. I cannot summarize now in a very short call, but I can definitely share with you this link so you can have all the documents you may need available. There are some measures that are not used, like maintaining social distance. Maintaining social distance and avoid contact as much as you can with patients, and try to keep at least 1 meter distance whenever possible. If you keep 1 meter distance, you may not need to wear any PPE. But if you break the 1 meter distance, you need to wear a surgical mask. Surgical mask is a mask that it's this kind. This type mask is used close contact with patients. Okay? And then the other measure that you may need is to have gloves, disposable gloves, because of course the infection spreads through contact. So whenever you need to touch your patient, you need to wear gloves. Not only when you touch patients, but also when you touch surface that near the patients. So the bed and all the desks and the toilet, for example, that are also used by patients. Yes, disposable gloves, as Lisa is showing. So you need to procure them in high number and maybe to contact other potential donors that may help you during the emergency. This is extremely important because we are facing shortage of people and we need donors as well. They are now donating this PPE from China because Italy is getting out of stock. Okay?
Marina,
Yes.
may I ask you, as soon as you are so keen on talking about to prevent, to get the coronavirus, can you also say something about how many people, several doctors, have died because of the...
Yeah.
So probably it's a case to tell them as well,
Yes.
just to prevent
Yes.
and to...
In Italy, we are facing...
I don't know how many. In Italy, a lot of them.
around 100 doctors already died. 100 doctors, but
100
definitely the number of nurses and other healthcare workers is much higher than that. Many of them are now admitted, also in our ward, and so the risk for healthcare workers is really high. Not only when they interact with patients, but also when they interact among themselves.
Exactly.
Because in some way, when you interact with patients, you know that there is a high risk, and you wear PPE. But after interacting with patients, you tend to feel safe. And when you talk to other doctors, nurses, and you share the same rooms, if one got infected, he or she may spread the infection to the others. Of course, our numbers is really high compared to yours, but we are now considering ourselves infected. And to protect our colleagues, always wear this mask in hospital, not only in the patient's room,
So doctors don't
also
need
in the
to.
corridors, in the meeting rooms, in the whenever, wherever. And
Okay.
we don't touch ourselves. We keep social distance
Okay.
among colleagues. It's a very tough situation, honestly.
So I have two
It's very
questions, Professor Marina.
Ma'am, I have a question.
Yes.
How do you differentiate between the patients of COVID-19 affected and normal flu patient, which is running this now in many countries?
Yeah.
Do you understand my question, please?
Yes, I understand your question. It's a very difficult question, actually. We have also flu epidemic going on, and at the beginning, that means 1 month ago, we tried to test all patients with the flu-like syndrome for both for coronavirus and flu. We had both tests performed. And in some cases, we found only coronavirus. In some cases, we found only flu. In some cases, we found both. Now we can't ask our lab to perform such a huge number of tests because the number of patients is dramatically high. So we stopped testing them for flu and we just test them for coronavirus. Coronavirus test, however, is not perfect. We do pharyngeal swabs. It's not perfect. So sometimes now we decide to treat patients though the swab is negative. To treat means providing coronavirus treatment, even though the test is negative, if the clinical suspicion is very high. Now, when the patient presents himself or herself to the clinic, you can't differentiate flu from coronavirus. But clinically, the patient will tell you that he's fevering, coughing, feeling very weak, maybe with some nausea and vomiting. So the symptoms are really similar to the flu symptoms.
Okay.
You can't differentiate on clinical basis, except maybe the duration of symptoms. That coronavirus may have a prolonged duration compared to flu. Flu is usually self-recovery in 4 or 5 days. Coronavirus may be extended to 15 days of fever, 15 days of cough. Okay?
Okay.
But clinically, it's very hard to differentiate.
Ma'am.
So you may need to do some tests.
Okay. Is there any chance of corona-affected people to remain symptomless for many days?
Yes. Luckily, there is quite a good proportion of patients with coronavirus that don't report any symptoms.
So only detection, only test is where to detect.
This is very tough. This is if you have enough resources and if you have enough tests, you may decide, for example, to test the family members of coronavirus patients.
Because in our country, we have very limitations of testing kit.
Yes.
Okay. There are many hotline number. After calling this, government call the patient to collect the sample. Just 1,200 people are tested for corona, but many people have symptoms like symptoms. We are really facing difficulties for this reason.
Yeah. No, I understand. We are also facing now shortage of tests because we tested so many people. We gave priority to people with symptoms and we gave priority to their family members and healthcare workers. But now we need to decide what to do because we can't continue testing everybody. So we never tested the general population. We never tested like going house by house, testing everybody. This is not possible because you need a high number of tests. But of course, when the patient presents himself in the clinic, if the symptoms were suspicious for coronavirus, we got tested. But now we can't test them anymore. So the decision may be on other criteria. That may be we use now other criteria that may be like chest X-ray. We have chest X-ray available. I don't know of course, your situation is much different. We have blood tests with full hemogram. So we decide also based on the full hemogram, especially if we see white blood cells count lower than the normal values, lymphocytes value below the normal values. So this is something that help us in identifying the suspect coronavirus. And so the chest X-ray showing usually a bilateral pneumonia.
Bilateral pneumonia.
Bilateral. Many cases is bilateral pneumonia, viral pneumonia.
Yes,
not single infiltrate, but very diffuse. Yeah.
Ma'am, one last question from me. Do you think there is a really effect of temperature on coronavirus?
Temperature, we measure in centigrade, Celsius.
Yes, centigrade.
Yeah. And we see patients with different temperature pattern. Some of them develop quite high temperature, above 38 degrees.
38.
Yeah, 38. This is usually associated with a more severe clinical picture. High fever, more severe clinical picture.
No,
but
I
many
mean,
people.
I think he meant that the weather, temperature of the country or the location.
Sorry. Yes, I hope that high temperature may limit the spread of infection. So.
Oh yes.
Yes.
It was my question.
We have now around a temperature between 10 to 20 degrees. 10 to 20. And we really hope then in the next month when the temperature will raise a bit, reaching maybe 25, 30 degrees, situation may be a bit better, like flu.
Okay, yeah, that's really great news for tropical weather countries like Malaysia, Bangladesh, Thailand, India.
Yes, I really hope. We hope the same.
Yeah, this is really great news. And I have two questions. Like, there is a lot of misleading information. Like, do doctors need N95 masks, like a special mask, or normal mask will help?
Yes, they may need the N95 mask, especially if they are very close to patients when there are activities producing aerosol.
Okay.
Like if a patient is under oxygen therapy, there is a lot of aerosol production.
Okay, yeah.
So the surgical mask is not enough to protect the healthcare workers.
Yeah. Okay.
So any activity producing aerosol will require healthcare workers to wear N95 mask.
Okay.
Oxygen therapy, bronchoscopy, in case you do bronchoscopy, or any other activity producing aerosol.
Yeah.
We have a lot of patients in ICU under ventilation.
Okay.
Of course, ventilation will also produce aerosol.
And another question is, if someone is going for grocery shopping, like to buy some groceries, and some maybe positive patient touch this food or something like that, or plastic, and if I touch this packet, can be just like transmitted or something like that.
Yes, can be transmitted through contact. So you need to really teach your people to wash their hands, wash their hands, and wash whatever they bring to their house.
Okay.
Wash food.
And we should this.
Yes, you can use disposable gloves. But I would suggest to limit the use of gloves to the hospital setting. Otherwise, if you use during your daily activities in your house and whatever, you will run out disposable gloves.
May I ask you one question, please? And if you go and buy vegetable, whatever it is, water is sufficient to make this vegetable usable or not? Is water enough?
I'm not sure if water is enough, but there are some, how do you say, some substance you can add to clean the water. How do you clean your water?
Clean the water, I mean
drinkable water. What do you use to have your water purified?
for vegetable, I just use water, plain water, and that's all. But the question is it enough? This is the question.
If the water is clean, yes.
Yes, I'm talking about clean water, of
clean
course.
Water, yes. Clean water.
Clean water is enough.
I think it's enough.
Okay.
And of course, for your hands, you need even soap.
Sure.
Yeah.
So,
but for vegetables, you can't use soap. So clean water is enough.
Okay.
So, how can we provide the primary healthcare services to the people suspected cases of COVID-19 infection in our local setting?
I believe that you may contact the Ministry of Health, ask if they have any stock, if they can help you. But of course, you can't think to change your mask every 2 hours, as recommended. You need to keep the mask very well and to use for a prolonged period of time, because there are no masks available at global level. So it's in Italy, some factories decided to produce masks. Some materials factories, some tailors, they started now producing masks. Of course, maybe they are not the same standard as the medical mask, but it's better than nothing.
Okay.
Sure.
There are also some solutions that we use to clean our hands, and you may need to produce them. You may find also how to produce them in the internet. So you may also decide not to buy, but to produce. I really recommend to produce because it's cheaper. It's much cheaper, and it's a solution with alcohol. You need to produce and to teach your healthcare workers, your patients, to wash their hands as much frequently as possible with this. You may not have water everywhere, but if you have one box like this with you and you use several times a day, it's really healthy. Even in your house, you can teach your family members to wash their hands and to have something in their pockets also when they go around to wash their hands very frequently.
Ma'am, we have another question. What are the procedure you are following in case of treating a corona affected people? Symptom based or other?
mainly is symptoms based. As I told you, we also use other tools like chest X-ray, blood test, age, so comorbidities. So there are some elements that you may need to use to decide which is the best treatment. Of course, there are patients that present themselves when they are very severe, in advanced stage of the disease with very severe respiratory failure. They need admission and they may need quite heavy treatment. And we are now using one drug that is still under research. That is
Which drug?
tocilizumab.
Okay.
So we use tocilizumab in very severe patients. But usually the value of this drug is not in the early stage of the disease. It's usually in the final stage of the disease when you have a cytokine storm. Very, very heavy inflammatory response. But in the early stage of disease, we use hydroxychloroquine.
Hydroxychloroquine.
Yes, hydroxychloroquine.
In our country there is a proposed prophylaxis for the COVID suspected infection, azithromycin and hydroxychloroquine.
Yes.
Is there? Is it?
Yes, we use the same combination, but now you have to consider that both drugs, azithromycin and hydroxychloroquine, are both QT prolonging drugs. They prolong the QT interval, both of them. So you may need to consider if you want to use both the drugs or just hydroxychloroquine based on the patient's risk factors. Cardiopathy or previous heart attack, heart failure is considered in our setting a risk factors. So you may decide based on the age and clinical history, cardiac history, to just give only one of these two QT prolonging drugs. And if we have to decide, we prefer hydroxychloroquine.
Hydroxychloroquine.
Yes. So hydroxychloroquine is our first choice. The second choice is combination of hydroxychloroquine and azithromycin. The third choice is a triple combination. Triple with hydroxychloroquine, azithromycin, plus a protease inhibitor used for HIV. It may be lopinavir, ritonavir, or another protease inhibitor. I don't know how available are them in Bangladesh. But I believe that if you stick to the
Ma'am, please again say about the third drug. What is this?
lopinavir, ritonavir.
Lopinavir, antiviral.
Ritonavir or darunavir, but I don't know if they are available in Bangladesh. Anyway, protease
still not
inhibitor for
marketed in
HIV
Bangladesh.
infection.
Yeah, still not marketed.
But I believe that if you have hydroxychloroquine and azithromycin, is already very nice.
Yeah. This
In our
whole drug is
setting-
available.
In our setting, the most of our patients are in their older age, above 70 years old, above 80, and sometimes even above 90 years old. So, of course, the cardiac risk is quite high, and this is why in several patients we just provide one drug, hydroxychloroquine. But if you have young patients with no risk factors for cardiotoxicity, then you may decide to give two drugs
Combination.
combined. Okay? And I believe this would be the most of your situation. You have much younger population compared to ours. So if you don't have risk factor for cardiotoxicity, really you can use 2 drugs
As the
for 5 days.
Marina, you
For 5
said that you had half an hour time. It is 45 minutes. Can you go on still, or if there are questions, or your time is?
I suggest 2 more questions, and then really I need to leave.
Okay,
If you have
2 more
2
questions.
burning questions.
Okay, Asaf, you can question.
ma'am, I have a question.
No, I have no question, but okay.
I have a question, ma'am. Actually, when to refer a patient of COVID-19 infection patient to ICU or high dependency unit? When to refer patient or transfer patient from general cabin to ICU or SD?
You may decide based on the
Parameters.
clinical picture
Just want to know parameters.
and oxygen. How do you say? Peripheric oxygenation.
Saturation.
Yeah, saturation. Yeah.
Yeah.
So based on those elements, you may decide to send them in ICU. I hope you have a better situation compared to us. I
Please
wish you
pray
all
for
the
us.
best.
And for the situation in Bangladesh, I hope you will always will be beside us, and you will promote and you will share your experience with our doctor. dear Professor. So thank you so much for joining
To us.
and in your humanitarian times to Voice of Humanity Bangladesh. Thank you so much.
Thank you.
And thank you
Grazie
all.
Marina, grazie.
you.
Grazie Marina, grazie. Thank you Marina. Thank you.
You're welcome.
Thank you so much.
Ciao, ciao.
So much. Thank you. Thank you Marina. Really.
তো বন্ধুরা, আজকের এই ভিডিও থেকে আমার মনে হয় আপনারা অনেক দিক নির্দেশনা পেয়েছেন, ডাক্তাররা কি ধরনের চিকিৎসা করবেন এবং কি ধরনের মেজার আপনারা নিজেরা নেবেন। তো এই ভিডিওটা যদি আপনাদের ভালো লেগে থাকে অবশ্যই সবার সঙ্গে শেয়ার করুন, বিশেষ করে ফেসবুকে শেয়ার করার মাধ্যমে সবাইকে জানিয়ে দিতে পারেন। আর সবাই ভালো থাকবেন, যে যেখানে আছেন সুস্থ থাকবেন। দেখা হবে তাহলে সামনের কোনো ভিডিওতে। ততক্ষণ ভালো থাকুন। আল্লাহ হাফেজ।